All right, this lecture is going to be on Buerger's disease or Buerger's disease, also known as thromboangiitis obliterans. Now let's break this word down again in case you see this on the NCLEX exam. Thrombo meaning clot, angiitis or inflammation of vessels, blood vessels. Now these two things combined, a clot and inflammation in blood vessels, can lead to narrowing of blood vessels. If the narrowing is severe enough, if the clot is big enough, then you can have an occlusion or a blockage of blood vessels. In this case, in Buerger's disease, we typically look at or are concerned with these small vessels in the hands and feet. So again, you want to focus on the hands and feet. If you see this question on the NCLEX exam. Now typically this affects men more than women, and the cause, and I'm skipping ahead here, but the cause is smoking. The exact mechanism of how things unfold or how smoking causes this is not known, but again, smoking does cause this to occur. Now what ends up happening, again, clotting and inflammation causes occlusions in the hands and feet. Now as a result, ischemia will occur, or a decrease in blood supply to the hands and feet. Now due to this decrease in blood supply, again, every part of your body requires oxygen to stay alive, including your hands and feet. So if you have a decrease in blood supply, you're going to have a decreased O2 supply. Now, this will result in color changes, in temperature changes in the hands and feet. It will result in cold sensitivity, along with pain or intermittent claudication. Just a big fancy word for pain. Okay, this pain or intermittent claudication is caused by the ischemia, by the lack of oxygen to that area. Now, along with this lack of oxygen to that area, this pain or intermittent claudication, you will also have paresthesia, or a tingling or pricking sensation in the extremities. Think about it whenever your leg falls asleep, you get that weird sensation. That is essentially paresthesia. Now again, you have these sensations, this pain, this cold sensitivity, these color changes, due to, again, the decrease in blood supply caused by the occlusion or blockage of either a clot or inflammation or both. Now, if the occlusion, if that finger, if that foot, if that toe becomes completely occluded, becomes completely blocked, then no blood can supply that area. If no blood can supply that area, what ends up happening is tissue necrosis or tissue death. Now, if necrosis occurs, this will require amputation. Okay, so it is very, very important. We're moving on to our treatments, interventions, to inform your patient to stop smoking. That is the number one thing that you can do, that you can tell your patient, is to stop smoking immediately. If they do not stop, then again, all of this will occur, and the end result may be tissue necrosis and either a finger being amputated or a toe being amputated. If this worsens, maybe the entire foot may be amputated, or maybe something like a below the knee amputation may be required. So again, for you smokers out there, stop smoking. Number two, due to this ischemia, something like an ulceration may occur. Now, you are always worried about ulcerations if you have a decreased blood supply, because again, that area can become infected. Now, if an ulceration is present, typically the physicians will order some type of antibiotic therapy, again, to help the ulceration dissipate, help get rid of the ulceration. Okay, so that's number two for our treatments and interventions. Number three, you will instruct your patient, you will educate your patient to avoid any trauma to the hands and feet. Number 4, hopefully this does not occur, but again, you must inform your patient that if smoking cessation does not occur, if they do not stop smoking, the end result will most likely be some form of amputation.